aligners like this is actually a plastic device that has been made to move teeth sequentially. So I think it's very revolutionary because it used to be metal braces, and then what happened is now we are using plastics like this. With, it's soft and everything. People wonder, how can this actually move teeth? But with every single aligner, it moves the teeth just a tiny little bit, and in sequence, we can move teeth over time. And that's how clear aligners move teeth. So it's very comfortable, unlike metal brackets and wires and everything. So the comfort level is just very, very, very good. And hygiene is one of the key things that we always emphasize for patients. So this is a very, very good device because you can take it out, you can clean your teeth and put it back. So it has completely changed the face of what you call teeth straightening. It always gives some form of mild discomfort. I would use it. And normally with any form of teeth straightening, whether it's brackets or braces and clear aligners, there's always some discomfort. But most of my patients' feedback is always very manageable. And when it gets really uncomfortable, usually something is a little bit, not so right, because when it goes beyond a certain pain threshold, it means the force on the tooth could be way too great, and then you should actually inform the dentist that's treating you. You are guaranteed to have straight teeth with clear aligners. However, there are certain situations where we actually may have to run through more than one session or one series of aligners, and then we'll go through one more round of series just to tighten things up or to realign certain things better. So teeth straightening is almost, I would say, a guarantee as long as you wear the aligners. Because if the aligners is out of your mouth, it's not going to do any work. So very important that the discipline of wearing the aligners, it's really very important if you really want to get a straight teeth. So yes, it will move teeth provided you wear them. And sometimes we need to do a round 2 of a session of another series of aligners just to really get it really, really straight. You can definitely have one row of teeth fixed, whether is it upper or is it lower, and it can be arranged that way, and that's the beauty about Invisalign. We can actually decide, I only want to move this portion of the tooth, all right? And the rest can be used to anchor that movement down. So that's actually the beauty of aligners, or what they call clear aligners, as compared to brackets and wires, because when you put a bracket and a wire in, everything moves. So with clear aligners, I can decide which tooth move and which tooth stays put. So that can be done. Well, most people are scared because they are not sure what's going to happen or what's coming up, So a lot of times it's very important that you speak to the dentist and the dentist team about what to expect from the whole treatment, right from the start all the way to the end. And as a dental clinic and my dental team, I guess we will always cover all the aspects, like from visit number 1 and what to expect. And once the patient knows what he or she is going to go through, I think the fear usually goes away. And I think that's something which a lot of people have, this fear of the unknown, we call it. And once you don't know what's going to happen to you when you get to the clinic, and that's when all these fears start to surface. So address all these fears with us or with any dentist that you're going to visit. And then, you should be able to allay all these fears, especially when it comes to the clear aligners. You won't get your clear aligners on the same day as your consultation, because there is a series of visits that we actually have to put you through first before you receive the clear aligners. So like a consult usually will diagnose the misaligned teeth that you have, and we will try and ascertain what needs to be done. And then after that, we actually have to design what we call a clean check, or using a software we can simulate the teeth movement And then we'll sit down and we'll discuss again the end goal, whether that's something that you want to achieve. So in other words, you pretty much will see the end product of your teeth alignment and the straightening of your teeth. Then once that's done, and you approved it, or we approved it together, that's when we manufacture the aligners. After that, there's usually a 1 week to 2 weeks wait before the aligners are shipped over. And that's when we give you the first set of aligners. So you won't get the aligners at the day of the consultation, but after 1 or 2 visits, you would be able to receive the first set.
Don't forget to like, comment, and subscribe for your regular dose of Asian health information.